Okay, yeah, so a bit of a quick break there, but yeah, we'll just be going on to the next speaker here. And next up, I'll be introducing Dr. Stephen Graves from Cal State Northridge, Department of Geography and Environmental Studies, who will be presenting on the topic of COVID-19 in Los Angeles, a neighborhood level analysis of causal factors. So with that, I turn it over to you, Dr. Graves.
Hi, everybody. I thought maybe I should have done something on the Antelope Valley. I worked extensively a couple of years ago mapping the RIPA data. I will share my screen really quickly, and I pulled it up very quickly. This was our hotspot map of stops, contacts as they called them, and then when I have assaults or something else here, but this was our hotspot map that my students and I did with a legal group that was contesting the unevenness of traffic stops by race. But that's not what I'm here to talk about, but I just thought I would throw that out to the excellent presenters from before, and hopefully we can chat sometimes afterwards through email. What I am presenting on is the COVID-19 research that I did a year or so ago. Let's switch the display settings there. You can see that, correct? Hopefully,
yes.
See it okay?
Yes.
Yeah, good. So what I had created in the early days of the pandemic was a dashboard that in response to my mom, who lives back in Ohio, noticed that a number of the dashboards that were on television or that she was seeing in the media showed Los Angeles as this massive hellscape of COVID. But I had to explain to her, hold on, Mom, Los Angeles has the same amount of the same number of people as the entire state of Ohio. And so what you're seeing is not normalized for the population. And so I started creating these dashboards. And then what I found far more interesting, by pulling the data from the LA Times GitHub and mapping it using not Esri products, but Microsoft Power BI, that distinct patterns were emerging in the neighborhood rate of COVID-19. So a grad student and I began to watch these patterns, and then we were trying to essentially predict where it would go next, and then to explain what the causal variables were behind this map. And we picked March 15, 2020 as the sort of the date that we were going to analyze. It was at the end of the first major wave. So it had swept across the entire county. Everybody had seen it. In the earlier days, it was just some of the nicer neighborhoods like Brentwood and the West Side, where you had a lot of jet setters and people who had been to ski resorts, and they were the ones bringing it to LA along with international travels. We also were unimpressed by a lot of the other analysis of COVID-19 rates at the state level. Scale became very important to us because we understood by mapping it at the neighborhood level that there were vast disparities in the rate of COVID-19 at the neighborhood level. And so you can see here the coastal areas had rates of less than 5,000 cases per 100,000. And in the red dots, Pacoima, Arleta, San Fernando, and then some of the stuff on the near and south, near east and near south side to downtown had rates of 5 times as much. We started out with a total of 350 neighborhoods across Los Angeles being served up by the LA Times GitHub. And we found that we had to break that down. LA is a great place to do studies of, well, almost everything. It's because we got 10 million people, incredible income and ethnicity diversity, and incredible housing diversity. That turns out to be important in the COVID situation as well. A lot of tourists and a big jet set population. So these were all of the really juicy morsels that a lot of other analysts studying other places couldn't find. These were our data sources here, the LA County Public Health, and then ultimately Long Beach Public Health Department and Pasadena Health Department, and they were served, and LA Times collects their data every day, serves it on a GitHub, and we connected to that GitHub to download our data, and then we combined it with the demographic data from Esri's business analyst suite of tools, which is really nice. So we took the LA Times / City of LA's 350 neighborhoods, and we joined the block group data from the 2019 community survey data to these neighborhoods. The primary variables we were looking at: income, ethnicity, housing type, educational attainment, occupational variables that we had found in the literature on COVID-19 from the epidemiologists. They were saying these are the things that are causing the variation in COVID rates. And so we selected a number of alternate candidate variables. We had 5 different ways of measuring income, for example, and Esri provides this pretty generously to those who have that access to that data set. And we just ran exploratory regression to begin with, and then that gave us some models. Here are the variables that the computer, the software, was telling us we should look at most closely. And we use that to run ordinary least squares regression, which is the standard, least controversial types of data modeling. What we found, though, is a problem when you're working with LA data so often is that there are 350 were too many neighborhoods, and those neighborhoods were really quite small. And as you know, COVID-19 and other diseases don't respect boundaries, and they spill over quite a bit. And so what we wound up facing problems with was something called spatial autocorrelation. So we had to merge our tiny neighborhoods, like some of them, like Thai Town and Little Armenia, into larger neighborhoods that had shared demographic characteristics. Note that we couldn't find a neighboring neighborhood to Chinatown that had a lot of characteristics similar to Chinatown, so we didn't merge it. Little Tokyo, on the other hand, we merged it with the wholesale district. It was easy to do the first round. We merged neighborhoods until we got down to 90, and then ran all of the tests again, the ordinary least squares regression. But again, we had some problems with spatial autocorrelation. The Moran's I was greater than 1.96. And so we went from 90 down to about 66 neighborhoods that have some measure of internal cohesion. And that was really the most difficult part of the whole thing. It was finding 66 generally similar regions within LA that weren't completely arbitrary. And this is the map that we came up with, and the infection rates of each of these regions. Then we just had to select the variables that appeared in the model and the final version of the model. And what we found that made the model most robust, that did the best prediction, was the ones on the screen here: mean household size, the percent of people living in rental houses, percent of Hispanic population. Those were all positively correlated with COVID-19 infection rates. And then we also found that percent Asian population, median household income, and the percent of people living in group quarters were all negatively associated with COVID-19 infection rates. So this is our model coefficient table, and I have the little sort of surprised face on it because it came out so robust. The very first pass we made at it was like at 0.88 R square, meaning that we were explaining 88% of the variation in COVID-19 rates across LA County using these variables. And that's an extremely high R squared. And I guess we could have been accused of over specifying the model, but we didn't have to work to get this. It just spilled out, and there was very little adjustment to be done to anything other than to get the spatial autocorrelation, the Moran's I score, down. And so what we see here is that household variables, particularly mean household size, was the most robust of the variables in determining the rate of COVID-19 in 2020 by neighborhood. All the rest of those contributed and were significant contributors to the model, with the exception of percent living in group quarters. Now, we added that at the end in order to explain a couple of the sort of crazy outliers. There was the West LA Veterans Administration Hospital was an outlier that we couldn't explain until we throw that in there. And up in Castaic, I think it was Castaic, there's apparently a prison facility or a detention facility of some sort that also had that was a constant outlier in terms of having a really high rate. And so we were explaining again about 93% of the variation. What that tells us is that COVID-19 and probably a lot of other related infectious diseases are pretty predictable. Everybody can get it. And the people who were least likely to test positive were the ones who were in the smallest households. So they had less exposure to the public through people leaving the house and then bringing it back. And people who had more money could afford oftentimes to stay home. The essential workers turned out to be oftentimes Hispanic or Latino, Latinx people, and they were even accounting for the household size and income also at a disadvantage or got COVID at a higher rate. One Mexican-American writer in the LA Times suggested it was because Hispanic people, or particularly Mexican Americans that he was around, carried on with their lives with a little less caution. Quinceañeras and birthday parties and family get-togethers are so important in that community that that the lockdown did not have as great of effect on the Mexican American community that he was writing about, and that sounded like a fair assessment. And we speculated that percent Asian was negatively associated because of the early and aggressive adoption of mask wearing and social distancing by Asians. I noticed here at CSUN, Asian students were masking up well before anybody else, and even in the years prior to the pandemic, during the flu season, Asian students were easily the most likely to appear in class with a mask on. And but the
Dr.
most
Graves,
important,
just a couple minute warning, just giving you a quick heads up.
oh, excellent, thank you. And but the main things was really your housing situation. If you had a lot of people living in your house, and if you were living in a rental housing, lots of apartment blocks where you have shared corridors and shared knobs and shared laundry spaces, that puts you at greater risk. So this is the residual map, and what it tells us is that the places in red had more cases of COVID-19 than one would expect given the conditions in the neighborhood, and the places in blue had less, and the sort of green area. So what we speculated is that one of the last variables that we should have included in the model, but by this point it had already been published, was air quality. We know that in the eastern San Fernando Valley, air pollution is a problem, and that it's less a problem up in the mountains and the high desert areas and along the coast. So if we could run this again, we would put air pollution in there. And I think I'm about out of time, so I'll clean it up right there. And if there is time for questions, I'll be happy to answer those.